Good day, I am Laris Gabriel Bersualo. Today I'm going to demonstrate the Total Parenteral Nutrition Administration. So the first thing that we're going to do is to check the physician's prescription for the TPN, including the correct solution, the infusion, additives, duration, and the correct vascular access. So let me check first the doctor's order. So the doctor ordered TPN 2 liters infused via central venous catheter, infused for 83 ml per hour for 24 hours. So after that is we're going to prepare the equipments that we will be needing, such as the TPN solution, the IV tubing with filter, the infusion pump. We have here a prototype or assumed infusion pump, and also the alcohol swabs, the proper PPE, and also other more things that we will be needing, such as alcohol. After that is we're going to inspect the TPN solution for the, and also the tubing, the IV tubing for the correct solution, clarity, integrity. We also need to inspect the expiration date and also check their functionality. Okay, so assuming that this is the TPN solution, so assuming that this is already pre-mixed, so let's check if there are any particles that is floating. Okay, so the expiration date is also this is not expired. Then for the tubing, let's check if there are any kinks. Okay, so there are no any kinks. Then after that, after inspecting, is we will now proceed in introducing ourselves to the patient and also explain to them the procedure. Make sure to identify them correctly using two identifiers, and then make sure to explain the benefits, the risks, and obtain their cooperation. Okay? So, good day, ma'am. I am Laris Gabriel Bersuala, student nurse po from Pamantasan ng Luzon, Pasig. May I know your name, ma'am?
Andra si Adra.
How about your age and birthday po?
I'm 51 years old. And I was born on June 6, 1975.
May I check your ID band, ma'am, just to confirm? Alright, ma'am. So, ma'am Adra, right po. So, ang gagawin po natin today is meron pong order si doctor na mag-a-administer po kami ng TPN, or also known po as Total Parenteral Nutrition. So, yung TPN po is para po siyang pagkain. Pero except, yung pagkain na po to is papadaanin po natin sa bloodstream nyo, since yung stomach nyo po hindi po makadigest ng food, or hindi po pwede mag-digest ng food. So, yung TPN po, naglalaman po siya ng nutrients, ng vitamins na mahalaga po para sa overall requirement po ng katawan ninyo. So, ipapadaan po siya sa central venous access nyo po, and this will take about 5 to 10 minutes lang po sa pagkakapit, and 24 hours po siyang nakalagay. Okay po, ma'am? So, meron po ba kayong tanong bago po tayo mag-proceed?
Wala naman.
Meron po kayong any concerns?
Wala naman.
Okay, so, can I ask for your full cooperation, ma'am? Okay, so, prepare ko lang po yung mga gamit. Then, after that is we're going to proceed in verifying if the informed consent has been obtained if ordered by the doctor, and also according to the institutional policy. Then, after that is we're going to perform the hand hygiene, and then make sure to put on your appropriate personal protective equipment. Make sure to maintain aseptic technique while doing this. Okay, so after that is we're going to proceed in assessing the patient for their condition, the And we're going to verify the appropriate vascular access for the TPN. It is usually in the central venous catheter. And then we're going to obtain the patient's baseline vital signs before administering TPN. Okay? So, ma'am, kumusta naman po kayo? May nararamdaman po ba kayo masakit?
Wala naman.
Okay po, ma'am. So, sa as IV site nyo po, ma'am, may sakit po ba? Nangangate? Hindi naman po. So, kukuhaan ko lang po kayo ng vital signs, ma'am, bago tayo magsimula. So, kailangan ko pong kunin yung BP nyo po, yung temperature nyo, and yung auto set nyo po. Okay lang po ba, ma'am?
Okay.
So, kuhaan ko lang po kayo ng BP. Ma'am, paangat na lang po ng ano niya po, damit. Thank you po. Okay po. So, relax lang po yung kamay, ma'am, ha? (110/70 po, ma'am. So, normal naman po. Check ko na lang po yung temp nyo po and yung autosat nyo po. Okay? So, palagay na lang po ng fingers here. Okay? Check ko lang po. 36.6 po, ma'am. Wala naman po kayong lagnat. Po. Okay? So, normal na naman po yung respiratory rate nyo po. So, 14 po yung nakuha ko. And sa pulse rate nyo po, 91 po. And yung auto-sat nyo po is 100% na. So, pwede na po tayo mag-administer ng TPN. So, prepare ko lang po, ma'am, yung TPN. Okay? So, after getting the baseline vital signs, since it is all normal, we can proceed in administering the TPN. So, make sure to prepare the TPN and the tubing aseptically. So, assuming that this is for the TPN, we're going to remove this and make sure to do not touch the insertion spike. And make sure that you will also disinfect the port just to be sure. So, but since this is sterile, I'm going to, and we're going to dispose that later. So, I'm going to remove this. Make sure to maintain the sterility of the spike. And then, insert this. Okay. So, now that we have inserted this, we can now hang this. Okay, so now we will hang this. Then after that, make sure that we're going to regulate this using our infusion pump. But first is we're going to disinfect the Y port or the injection port of the patient before connecting the TPN tube. So, make sure that while doing this is we will apply the safe medication administration principles or the 12 rights. Okay? So, ma'am, disinfect ko lang po. Okay? Then, dispose. After that is we're going to connect the TPN tube or the tubing to the okay. So after that, now that assuming that we have connected it already, we will now initiate the infusion into the prescribed infusion rate. So assuming this is the infusion pump, we will set this into 83 ml per hour to run for 24 hours. Okay? Then after that, after regulating this is we're going to regulate it and monitor the infusion accurately without any abrupt changes unless ordered by the doctor. Then after that, don't forget to monitor the patient during the TPN administration and look for any complications such as in the catheter infected complication, the hyperglycemia, hypoglycemia, infiltration, extravasation if peripherally connected, and then make sure to check if the patient has fluid overload or any allergic reactions upon administration. Then after that is we're going to proceed in providing the patient some reassurance and also provide them some health education for the TPN therapy and safety precaution. Okay, ma'am. So, nakapit ko na po yung TPN. So, this will run for 24 hours po. So, if meron po kayong mararamdamang masakit, magsabi lang po kayo sa aming mga nurses. And also, ma'am, iwasan lang po natin na pindut-pindutin po yung infusion rate. So, wag po nating pipindutin to para po hindi na po natin i-regulate po ulit. And also, ma'am, iwasan po natin na mahugot po yung swero po ninyo para po hindi na po tayo lumusok ulit, ma'am. Okay po? May mga tanong po kayo, ma'am? Okay po, ma'am. Thank you po for your cooperation. And then after that is we will proceed in disposing all the materials that we have used into a proper waste receptacle according to the Healthcare Waste Management, the DOH, and the DENR guidelines. So I'm going to dispose the materials that I use. Then after that is to remove our gloves and then perform hand hygiene after the procedure. Then next is we're going to document the procedure that we have done and make sure to document the TPN administration, the date and time that we have started, the patient response and assessment, and other important healthcare or nursing intervention that we provide to the patient. Then make sure that we will communicate with the patient and the other healthcare team member effectively, demonstrate being present to your patient, and then don't forget to use therapeutic communication. For professionalism and patient safety, we need to perform the procedure confidently and systematically, and make sure to demonstrate strict adherence to infection prevention and surgical asepsis principles. Then lastly is to complete the procedure efficiently while maintaining safety all throughout. So that's it for the TPN administration.